Hello again, everybody. Um, Please tell me you guys have seen this movie. Okay, now you see me too. Come on now, it's all about, the magicians trying to be a part of the eye or whatever. Okay, anyways, I really like it. It has Harry Potter in it, so it's got to be good. Anyways, we're gonna get into chapter 12 here. Okay, so going through, like we always do, kind of the anatomy, external structures of the eye socket, eyelid, the conjunctiva, the lacrimal gland. Looking here, if you need to refresh your anatomy, here's, the different bones involved and such. Oh, disclaimer, I meant to go through this earlier. So one lesson in medicine is that everybody has something that freaks them out. Okay. And if you say you don't, then you need a couple more years of experience under your belt. And everybody has something that makes them squeamish and that, they just don't like to see. Okay. It's not to say that, in those situations you can't handle it. And, you put on quote unquote, as my family always says, is like your nurse face and you just handle it. But why am I saying all of this? Because mine is eyeballs. Okay, I cannot stand something being wrong with people's eyes. Um, and It's kind of a deeply rooted thing of mine. So there are going to be no gross pictures in this slideshow because I don't want to look at them. Okay, so I suggest you open up your book as you watch this so you can reference the pictures and I can not get as nauseous as I look at those awful, awful pictures of eyeball things. Okay, that's honestly what kept me out of the emergency department as a nurse because I knew at some point in time somebody was going to come in with something sticking out of their eyeball and I was going to lose it. Okay, so anyways, full disclosure here. So I'm looking more at the external anatomy. Okay, so the lacrimal gland. Let me get my pen thing here. Oh, this is a highlighter. Oops. Um, Lacrimal gland out here, and then as you can see, it drains across the eye, and then down here, and then down through your nose. And that's why when you cry, your nose runs because it's not actually nose running; it's just the tears going down. Um, The sclera is the white part. Okay, the conjunctiva is the clear part over the top of the white part. Okay, those I think are the big parts I wanted to point out here. Okay, then this is, just all the words of, what we'll see on the next slide for the internal structures. Okay, so once again, take a look here. Back here is your optic nerve, so all the light has to come back to that point. And one cool thing about the eye is it's the only place in the body that I can see your blood vessels from the outside, and I can actually see how they're doing, and so I can look for signs of high blood pressure or like end organ damage because of high blood pressure, that kind of thing. You have to get really good at it in order to be able to see it well. Important, like I said, to keep in mind that the cornea is on the outside here, and that the lens is behind the iris. Okay. And then when we talk about like retinal detachments, remember the retina is this like yellowish thing. Okay. Ooh, fun. See, I like that. Okay. Um, Evaluation of the eye. It's important to get a really thorough history. When did it start? What makes it better? What makes it worse? Is it worse when you look at the light? Do you see like halos around lights? Does your pain get worse when you move your eyeballs? Those kinds of things, okay? Um, I feel like a lot of the stuff you guys will be dealing with, like you'll know what happened because it's a lot of trauma and such. But still important to keep that in mind. And we always need to check visual acuity. It's an entirely different story if somebody comes to you and says my eye hurts, and it's one thing if their vision is intact. It is an entirely different thing if their vision is not. And it's totally fine to if somebody wears glasses or contacts, test them with their glasses or contacts. Like we're not trying to see if their prescription's okay. We're trying to see, are they functional? Like can they read? James will go through with you how do you check pupils and such. And it's also important to note the speed at which the pupils dilate. And so if we go backwards to, was it last week we talked about the nervous system? Anyways, we talked about the difference between parasympathetic and sympathetic nervous system, and we were talking about, grizzly bear, rawr, or like teddy bear, right? And so teddy bear, parasympathetic nervous system, if you're just, cuddled up with your teddy bear, you don't need to see a lot, right? And so our pupils dilate and constrict based off of light and like how aware we need to be, okay? So so then logically, if a grizzly bear is about to attack us, we want to be as aware as possible, so our pupils are going to dilate, okay? The motility of the extraocular muscles, that's like the look at my finger and go through all the visual planes. It's totally normal when you get to the far extenses of people's peripheral vision for you to see a little bit of shaking. It's called nystagmus, okay? And it's okay in the supreme outside fields, but otherwise the movement should be symmetrical and smooth. You shouldn't see a lot of jerking, okay? And then, like I said, you can look at the internal structures of the eye using, ophthalmoscope. And like I said, you have to get really good at it. Like it's still even hard for me to see sometimes what I'm looking for. And it's never as cut and dry as, the pictures I'm going to show you. So like I said, visual acuity, you check it from, with a Snellen chart. You do 20 feet away, you're looking for that 20/20, which is normal, and that means that at 20 feet, I see what another person is able to see at 20 feet, okay? Pupillary responses, like I said, ability to react to light. You want them to look in the distance. You don't want them to look up close because that will naturally change and dilate the pupils. So it's like look away at the wall or something. And like I said, look for the speed. And it's just to be like, is it fast and even, or is it kind of sluggish? Like, does it take a little bit? And then once again, the motility of extraocular muscles. It's important that you remind people that you're supposed to watch your finger without moving your head, otherwise they'll be like this and following, and obviously that doesn't tell us anything. So those are the movements, and actually will tell you which muscles are controlling that, as well as the cranial nerves. And then those are the visual. You see, even this picture is like, well, anyways. Obviously I still treat people with eyeball stuff. That's just my thing. Okay, everybody has a thing, so that's mine. Okay, so peripheral vision, James will go through this as well. It is an important part of pre-participation visual testing. And you test one eye at a time, and you cover one eye, and then you kind of bring it up to see, okay, when can they see it? I was like, a lot of time today to do my transitions. Once again, this is more along the lines of your inspection, okay? So you want to look at the lids, the eyelids, and palpate the bony orbital rim, because that can reveal serious trauma after a blunt injury. And if there's any suspicion that, the trauma is severe enough to penetrate or even rupture the eyeball, then you shouldn't by any means put any pressure on the eye or even the eyelids. Okay, so this is, if you were using your ophthalmoscope, this is what theoretically you're supposed to see. It's never this pretty. And so, like I said, here's the optic disc, and all of this really isn't that important for you to know. It's really just to show that, there's different structures in the back of the eye which can help lead us down a couple of different routes. And these are just, people's prescriptions, myopia or hyperopia, because after all, we need to have fancy words for everything. Okay, so nearsightedness or farsightedness. Conjunctivitis, any itis is just inflammation of, so inflammation of the conjunctiva, which is, remember, that clear part over the top. Can be caused from bacteria, viruses, allergies, or even dry eye. Okay, so this is the stereotypical, I have pink eye. But which pink eye do you have? Typically when people say that, it's a viral conjunctivitis, which is, super, super contagious. If you want to see it, look at figure 12, 14, and 15, because like I said, I'm not going to show you. An important way to distinguish between like allergies versus infectious cause is infectious is never itchy. Okay, so if something's itchy, it's typically always allergies. Okay, and then the line between bacterial versus viral is, sticky and hard to navigate, so make it somebody else's problem. Okay, empyema is blood in the anterior chamber of the eye, and can be a complication of that blunt trauma to the eyeball. Figure 12, 16 will show you this as well. And it can be associated with, other types of, orbital or ocular damage. If you see something like this, you need to look further, okay? And the blood often comes from a damaged blood vessel in the iris or even the ciliary body, okay? So this is a bigger deal than a subconjunctival hemorrhage. This is essentially just saying it's the same as like a subcutaneous hematoma, which is once again a fancy word for a bruise, okay? And it looks awful. It looks absolutely awful. It looks like, ugh. Okay, so bright red blood appearing acutely in a sector of the eye under the clear conjunctiva and in front of the white sclera. So you'll just see it kind of pool there. Okay, and I said this is, the epitome of, its bark is worse than its bite. It looks a lot worse than it is, okay? And then corneal abrasions, abrasion, once again, fancy word for just like a scratch. And so people can get, abrasions on their cornea, and often they'll come in and just say, it just feels like I have something in my eye. And sometimes when you look really closely, you can actually see some of those scratches. And versus, corneal or scleral lacerations. This is a much bigger deal because this is essentially that the eyeball has ruptured after a blunt or sharp trauma or injury with a projectile foreign body. Okay, and this allows the intraocular fluid that helps maintain the eyeball's nice round shape. It allows that fluid to leak out, and it's a great medium for infection. Obviously, this is a huge deal, okay? And we haven't talked about this yet, but I don't mess around when it comes to eyes. If you want to talk about litigation risk, holy moly, you miss something and somebody loses their vision, that's a huge deal, okay? And so vision is, people's, it's their life, it's their livelihood. There's so much that goes into it. So if you have any question whatsoever, you get them out of there, okay? And I'll talk through, some warning signs, but really I would say, like, unless you're super certain, like, I'd get them evaluated, pass that buck off to somebody else. And this is just continued, and sometimes that object is embedded in or even adhering to the conjunctiva or cornea. And sometimes people say it's, scratchy, or there's something in their eye. And oftentimes, they're tearing up a lot. And it's not always visible. An orbital fracture, also known as like a blowout fracture, um, from that, blunt injury, and it can even push the orbital contents posteriorly into the skull. Retinal tear and detachment is more common in, nearsighted people who have had eye surgeries, eye trauma, or even family history. And it's totally possible for, you to tear or detach a retina again if you've had a previous history. So these people really need to avoid contact sports. Okay, it can be a result of illness, injury, um, or like I said, even just family history, like hereditary. A dislocated contact lens, when the contact moves from that normal central location, and it can be because, like, a result of a shearing force, and obviously loss of visual acuity because, the contact isn't, where it should be, and so it's not correcting their vision, and, presence of a foreign body sensation. Chemical burns. Oh, this picture was awful. Okay, so it's like this cloudy, awful. Ugh, just look it up in your book. It's this like super cloudy picture to their eye, and it's when certain chemical substances come into contact with the ocular surface, and this is why eye protection in certain occupations are absolutely essential. And it's that rapid onset of pain with a foreign body sensation and frequently loss of vision. Okay, and the signs are the defects on the corneal surface, the corneal opaqueness, and it gets really swollen, and it can look really, really cloudy as well. Okay. Oh. Okay, periorbital contusion, because once again, we can't just say they have a black eye. It's a periorbital contusion. It sounds much cooler. Okay, and results of, direct trauma to the periorbital structures and can result in that localized swelling. Okay. Oh, and it's a requirement for people to say, yeah, well, you should see the other guy. That's actually a diagnostic tool if they say that. Okay, not really. Traumatic iritis is, a big red flag as well. And so inflammation of the iris or anterior chamber secondary to blunt traumatic injury to the eye. And it's that dull, deep, aching pain when either the iris or the pupil moves. Okay. And the most common symptom is photophobia, pain with light. Okay. And important to note that this one can occur 1 to 7 days after initial trauma. Okay. So earlier on, in our history, I was talking about, is it painful to look at the lights? Is it painful if you move your eyes? Those are huge red flags to be like, okay, something bigger is going on. You don't get, you don't have pain with eye movement if you just have, an eyelash in your eye. Okay. Um, so yeah, keep those two in mind. And then once again, obviously, if their vision is affected. And it's also hard because vision and like eye pain can be secondary to a lot of things, like migraines, for instance. People often say, it hurts right behind my eyes. But then, as we talked about in the neuro section, people typically who have migraines have had migraines for a long time. It's not just like all of a sudden I developed a migraine. Okay. And so people with migraines will say, yeah, I don't want to look at the light and sound bothers me and such. And so this is where it can get kind of sticky. Okay. What is the source of the pain? Most of the time, if it's, eye pain specifically, they won't have like, headaches, and it won't have been lasting for 4 or 5 hours and happening every other day. Okay. That's why it seems excessive that we kind of talk again and again and again about history, but really, like we said before, like most of the time I have a pretty good idea what's going on before I even touch the patient, because most of what you need to know they can tell you. Okay. Proptosis, I think is how you say this one, and this was also really gross. Figure 12-26, and the guy's eye is like bulging, and that's typically the presenting symptom. And it can actually, cause damage to the optic nerve because of the compromised blood supply. Um, and then it's because of, direct trauma to the orbit that can result in deep orbital swelling, and hemorrhages and swelling that occurs behind the eye actually pushes that eyeball forward. Okay, so when I think of bulging eyeballs in, my practice, I think of Graves' disease, hyperthyroidism, because that can be a big, red flag for it. Obviously, I'm dealing with people who have less capacity for, these like super crazy direct traumas. And so it's just important to also note, like, who's my patient population? Like, is it a 65-year-old man, like, that's all of a sudden lost a bunch of weight? And so, okay, maybe I'll go this direction versus, a 22-year-old football player. Eyelid lacerations, fancy word for, a cut on your eyelid. Eyelid skin is the thinnest skin in the body, remember, and so it's really vulnerable. And it can present as that open wound. So protective eyewear. So just important to keep in mind that more than 100,000 sport-related eye injuries are reported every single year, and most of these occur in athletes under 25. And many of them result in permanent and associated with, serious vision loss. It's a big deal. And just appropriate eye protection is, paramount to anything. Okay. So make sure you look through those pictures, because it'll really drive it home for you. Really drive it home for you. A couple of things I know I failed to mention. Moving backwards to like infectious causes of like conjunctivitis. Important to remind people that they need to throw away their eye makeup. Okay, so I see this an awful lot in my patients, that like they get like a viral or a bacterial conjunctivitis, and then they keep using their mascara, and then they just keep reinfecting it, and so they really need to take like a break from, from obviously using eye makeup. And you'd think, like, with their eyes so awful, that wouldn't be high up on their priority list, but it all depends. And so anyways, it's important that they switch that out, because otherwise it'll just be a carrier for it. As well as their contact lenses. If they're wearing contacts, they need to put new ones in. Okay, and it's always important to ask about contact lens use, because that can increase people's risks for like the weird infections, like the fungal infections and such like that. Let me see. So yeah, big takeaways. Always check people's vision. Look for movement or pain with movement of their eye, as well as, pain with light. Those are kind of some big ones. And then, like I said, just refer. Like, don't chance it, because vision is a huge thing. It's not just like, somebody might, take a couple extra days to heal and recover. This is a big part of people's lives. So if you're in doubt at all, make sure somebody else sees them.